Welcome to today's lesson on patient assessment and vital signs monitoring, essential skills for every nurse. Whether you're working in an emergency unit, a hospital ward, or a long-term care facility, understanding how to assess a patient's condition accurately can save lives. Patient assessment starts with understanding the basics: blood pressure, pulse, respiration rate, and temperature. But it's more than just numbers. It's about recognizing patterns, changes, and warning signs. Let's explore how to approach patient assessment like a pro.
I used to think vital signs were just about numbers, but after a few close calls, I realized it's about knowing what those numbers are telling you about the patient's health.
Exactly. Now let's see what you already know. Which of the following is not considered a vital sign? Pain level is important, but not considered one of the core vital signs. Now let's walk through the steps of a proper patient assessment. Let's move on to the next topic, which is measuring blood pressure. Let's start with blood pressure. Position the cuff about 1 inch above the elbow, ensuring it's snug but not too tight. Keep the patient's arm at heart level. Nurse James, can you walk us through the next step?
Sure, inflate the cuff until you no longer feel the pulse, then slowly release the pressure while listening with the stethoscope. The first sound you hear is the systolic pressure. The point where the sound disappears is the diastolic pressure.
Exactly. Now let's test your understanding. What is considered a normal resting blood pressure for adults? Good job. 120/80 is considered the gold standard for healthy blood pressure. Let's go to the next lesson, the measuring pulse and respirations. Next, the pulse. You can measure the pulse at different sites. The wrist, radial artery, is most common. Use your index and middle fingers to gently press down and count for 30 seconds, then double it to get the beats per minute.
Feel steady and strong, about 72 beats per minute.
That's within the normal range. Now for respiration rate. Watch the patient's chest rise and fall. Count for 30 seconds and double it.
About 16 breaths per minute. Seems normal.
What is the normal resting pulse rate for a healthy adult? Spot on. A resting pulse between 60 and 100 beats per minute is considered normal for a healthy adult. Now that we've finished the measuring pulse and respirations, let's move on to the monitoring temperature. Next up, temperature. Oral, rectal, tympanic, ear, and axillary, underarm, are common methods. Nurse James, what's the normal oral temperature range?
Between 36.5 degrees Celsius and 37.5 degrees Celsius.
Exactly. Let's test your knowledge. Which temperature reading method is generally considered the most accurate? Great work today! Measuring and understanding vital signs is one of the most critical skills a nurse can master. Blood pressure, pulse, respirations, and temperature give you insight into a patient's overall health and help you catch early warning signs of trouble.
Feels good to get the basics down. Now I just need more practice.
Why is monitoring vital signs important in nursing? Exactly. Early recognition of changes in vital signs can make all the difference in patient outcomes. Keep practicing, and you'll be a pro in no time.